We have another amazing attending physician from the REACH program, Dr. Collard, who also does a lot of community work as well around substance use, and she's going to be focusing on alcohol use in honor of Pride Month. It's a reminder that in the 80s and 90s, there was so much overlap in our communities in Harlem as well as the Bronx of queer communities as well as people who use drugs, seeing a lot of disinvestment and people not caring as much about giving the right sort of medical care and access to medical care for the AIDS epidemic and for using drugs and safe sex practices. So a reminder that this month is all about pride, and then it's also Puerto Rican month too. So all important aspects of our community that are really centered around uplifting our people and reminding ourselves about how we take care of ourselves and care for our community ourselves. And that includes advocating and caring about everyone in the community. Harm reduction, we practice it in a lot of facets of our life. So that should also be something we think about in some of these other contexts of drug use and safe sex use, where it's not necessarily this all or nothing. Like you're still going to go in a car, even though there's risks with it, maybe ride a bike, even though there's risks with it, but you try to reduce the harm by wearing a helmet or wearing a seatbelt. These are the 7 pillars of harm reduction, and there's many different ideas that surround harm reduction, but the biggest ones that we think about is minimizing harm, not just ignoring or condemning drug use, acknowledging that it is part of our world. Just saying, just stop, it's not really effective or realistic for a lot of people. It encompasses a lot of different aspects of things that are happening socially too. We're not ignoring the real harms and dangers that are associated with drug use, but we acknowledge that while there is harm and danger associated with it, we are working towards minimizing that harm and not condemning or shaming around it or judging or coercing people as well. This is all about meeting people where they're at and creating more sustainable change that way.
I love that you brought it back to the fact that harm reduction, we really benefit from it in thinking about our health today. It didn't come from doctors. It didn't come from the healthcare system. It really came from strong communities. Community building activities like Smart University, I think, are such an important example of healthy steps that we can take to keep each other safe and healthy. Let's talk about safer alcohol use. Here's the outline from my presentation. Alcohol. Is it good? Is it bad? Then we'll move into talking about some of the health effects of alcohol use. And then when does alcohol use become risk and what are the potential issues that can arise? Then we'll talk about ways to drink in a safer way. And finally, we'll talk about for people who do have alcohol addiction, or we call it alcohol use disorder, what are the treatment options? There's no health benefit to drinking alcohol. It does make you feel relaxed while you're drinking it. So that could be helpful in the moment, but I'm not going to write you a prescription and say you better drink your wine or else your health is going to suffer. So no health benefits from drinking alcohol, but it is complicated because alcohol is a fact of life. It's been part of human society for generations. So it's not like we're all going to stop drinking alcohol anytime soon. So going back to our discussion around harm reduction, if we know that humans are going to drink alcohol, is there a way that we can do it as safely as possible and have the fewest bad outcomes? If you're a person who's likely to have health problems from it, if you're a person who knows that you can't just have one drink, if you have one drink, you're going to have another and another and another, it's important to know that about yourself. So how does alcohol affect our health? I'm a doctor, so it's important for me to make sure that you have the information that you need to make a good decision for yourself. So what are some of the health problems that can come up when people use alcohol? So just going through these examples, high blood pressure is a big one because high blood pressure is very common. And a lot of people are like, isn't there a way that I could bring my blood pressure down without taking medication? Sometimes medication is going to be necessary, but there are changes that we can make to the way that we eat, our exercise, and how much alcohol we drink. Reducing your alcohol use is a good way to bring down your blood pressure. Alcohol can also increase your risk of stroke, memory problems, and dementia later in life. So these are really scary things that we all want to prevent. So it is important for us to be realistic about the association between alcohol and these brain problems. Also, certain types of heart diseases, the heart rhythm problem, atrial fibrillation or AFib, where people have heartbeat that is irregular. They can feel their heart like flopping around in their chest. That can also increase the risk of other health problems like stroke. AFib is increased by drinking alcohol. Heart failure, where the heart muscle becomes weak, that's associated with alcohol use. The more alcohol use, the higher the risk. Lots of different problems with the stomach and digestion. So people can have irritation of the stomach, like gastritis, a lot of alcohol use, or even bleeding of the stomach. People can experience problems with the pancreas, where the pancreas becomes inflamed or swollen. That's called pancreatitis, and that can be extremely painful and is more commonly an issue for people who drink a lot of alcohol. Liver disease, cirrhosis, or really bad scarring of the liver where the liver is unable to function. That can be an issue that comes up with alcohol use. Drinking alcohol, especially more alcohol, can make your immune system weaker, so you can catch infections more easily. And then the last four categories are kind of like mental health, but also social issues. We often say alcohol is a depressant. So if you have one drink or you drink a little bit, often you'll feel like happy and excited and more talkative. But really the long-term effect or the effect of a lot of alcohol is that it makes you more tired and it can make you more sad. It can make you more anxious in the long term. And it can even increase the risk of thoughts about hurting yourself or ending your life. It can lead to issues, especially when somebody has an addiction. It can lead to real issues with performing in school or at work. It can cause fights with your loved ones. People can be very irritable or sensitive about talking about their alcohol use. That can lead to a lot of fights. And then finally, it can lead to accidents. Like if somebody's driving or doing other dangerous things while they're drinking alcohol, that can lead to really bad accidents and injuries. And it can also lead to getting arrested. It's a pretty comprehensive list of all of the bad things that can be associated with alcohol. So again, alcohol is common, but the more we use it, the more likely we are to have problems like this. There are cancer risks associated with alcohol and lots of different types of cancer. Cancer in your throat, in your intestines, breast cancer, cancer of the liver. So if cancer is something that you are very concerned about and really want to make sure that you prevent, especially if you have cancer in your family, then avoiding alcohol or drinking less alcohol could be a good way for you to protect yourself. Also want to highlight the effects of alcohol when you're pregnant. If you are currently pregnant, if you're starting to think about becoming pregnant, that's a good time to completely stop drinking alcohol because any amount of alcohol can be risky when you're pregnant. Drinking alcohol while you're pregnant can lead to birth defects, babies being born early while they're still very small and not fully developed, and issues with intelligence and other developmental lifelong issues. Safest just to not drink alcohol while you're pregnant. As we keep saying, alcohol use is very common. So this is a challenge that we have. People drink alcohol. There are real risks associated with it. So how do we find that middle ground of being as safe as possible? So as you can see here from the federal government, there was a study in 2023 that found that almost 85% of Americans drink alcohol at some point in their life as of 2023. So it's a really common thing. It's not something that should be in the shadows. It's not something we should be shaming people for doing. We should be supporting people to be as safe as possible. Let's focus on the figure on the left here so we don't get too bogged down in the details. We talk about with harm reduction, there is a range of ways to use substances, and we can use them more safely or we can use them in ways that are riskier with more potential for health harm. So we can see here, like the blue area of the spectrum, some people don't use alcohol at all, and that's very safe. Some people use alcohol, but they don't drink very much alcohol, and they're careful about how they use it. They don't drink very many drinks in one sitting. They don't drink very many drinks in a week. They don't drink and then drive or operate heavy machinery. They don't drink at work. So drinking is not really causing a problem for them. They don't have health problems that are made worse by alcohol. So for these people, it's really fine for them to continue drinking alcohol in that way. They're not likely to have problems from drinking in that safe way, in moderation. The next category in yellow, you can see that there are people who drink maybe more than is recommended. They're starting to have some issues in their life from their drinking. We wouldn't yet call it an addiction, but maybe those are people who we should be talking to more and saying, hey, is there a way that we could help you to drink more safely, get you back into this green zone? Or should we be connecting you with a doctor or other professional who can help to diagnose you with the final category, the red category, which is an actual addiction to alcohol? People who fall into this category, there's no like set number of drinks, like, oh, if you have this many drinks a day or this many drinks a week, you're automatically having an addiction. We'll dig into this later. But this is more about a description of people who find that they're having a lot of problems in their life, and those problems keep coming back to alcohol. So there are a lot of terms that we use to describe this category. I call it unhealthy use because it can have a lot of health harm, but it can also be called alcohol use disorder, alcohol addiction. We try to stay away from terms like alcohol abuse or being an alcoholic because at this point, those just have a lot of negative associations and they can make people feel a lot of shame. And that doesn't help people to come into healthcare and ask for help, talk to their loved ones. We really want to welcome people and to normalize this and say, this is a really common thing for for people to experience. So no shame. Let's just talk about it. So another way of looking at it is this pyramid on the right. Here we can see this was looking at how many people are likely to have issues from alcohol use. So at the bottom of the pyramid, we see that about 75% of people are not going to have a problem with alcohol. So either they don't drink alcohol at all, or they drink alcohol, but not very much, not in a way that's causing them problems. Then about 10% of people are starting to drink more than we would recommend. That's where we would call it risky. Another 10% of people are drinking in a way that is causing them harm. They're starting to have health problems from it. They're getting into accidents. They're getting arrested. And then 5% of people are having really severe effects. So they are experiencing liver failure that is going to end their life within the next few years from their alcohol use. And they're continuing to drink alcohol even though they have really bad health issues from it. So most people are not going to have a problem with alcohol. So that's important for us to balance even while we think about the real risk of alcohol use. Well, let's work through this slowly because I know this chart has a lot of information on it, but we're going to go through the top row and then the middle two rows and then the bottom row. Let's focus just on the top row right now. So this is getting into the nitty gritty of how many drinks we're talking about. When I talk about that middle category of people who do drink alcohol, but they're not having a problem from it, how many drinks is safe for us to drink? So our recommendation is that for men who are less than 65, that they should limit their alcohol use to 4 drinks a day. If a man under the age of 65 is going to a barbecue on a Saturday, we recommend not having more than 4 drinks during that barbecue. If you keep it to 3 or 4, then that person's unlikely to have a problem. If they start having 5 or more, then that's somebody who is getting into the risky category of alcohol use. And then the other side of that is how many drinks they're having in a week. So it's recommended that men under the age of 65 do not drink more than 14 drinks a week. What that means is that a man who has 2 drinks every night, the whole week, that can actually be okay. It's totally possible that that person will not have any health effects from that amount of alcohol. Once they're having more than 2 drinks a night, every single night, that's when we say that's risky alcohol use. They're at risk for developing an addiction. They're at risk for developing health issues. And then what about women? So we recommend that women of any age, and then also men over the age of 65, limit their alcohol use to 3 drinks in a single day. Going to that same barbecue on a Saturday, we recommend that a woman would limit her alcohol use to only 3 drinks. Once she's having more than 3 drinks, then she's at higher risk for developing health issues or addiction. Also recommended that a woman or a man over the age of 65 limits their alcohol use to 7 drinks a week. So that means a woman or a person over the age of 65, if they're drinking every day, they should not be having more than 1 drink per day. In order to say that your alcohol use is low risk, it's important for you to stick to both of these categories. So not drinking too much in one day and also not drinking too much over the course of the week. Let's look at the flip side. Now let's move down to the 2 middle rows. So this is where we get into the risky territory. And we're going to break down the risky territory. We're not talking about addiction yet. At this point, we're just talking about drinking an amount of alcohol that is risky, either puts you at risk for health issues or puts you at risk for developing an addiction. So there are 2 ways that this can happen. First is what we call heavy drinking. This is looking at the weekly amount. We would say that somebody is having high risk alcohol use because of heavy drinking if they're a man who's drinking more than 15 drinks a week, or they're a woman drinking more than 7 drinks a week. If I have a hard job, I'm trying to unwind after work every day, and I come home and I have 2 beers after work every single day, and I'm a woman, that's the kind of thing that if I tell that to my doctor, it's important for my doctor to give me that information, like, hey, that's risky alcohol use. That would be considered heavy drinking. We should talk more about how we can reduce your risk. And then the other side of it is binge drinking. Maybe somebody isn't drinking every single day, but when they do drink, they're drinking a lot of alcohol at once. We associate this with college students, young people, but really at this point, it's very common among any age group. Any person might be binge drinking, especially since drinks are so strong right now. We'll talk about that. What is 1 drink? You may be having like a glass of alcohol that actually counts as 4 drinks, and then that could be considered binge drinking all at once. So what is binge drinking? That is if a man has more than 4 drinks in a day, or if a woman has more than 3 drinks in a day. So back to that barbecue example, I'm a woman. If I go to a barbecue and I have 4 margaritas at that barbecue, that is considered binge drinking. I'm not saying something terrible is going to happen to me that same day or the next day, but if I start doing that regularly, hey, every Saturday I'm having 4 margaritas, that is high risk alcohol use, and that's going to put me at risk for developing health issues. And finally, we have alcohol use disorder or addiction. So again, there's no number of drinks cutoff for this. This is more of a big picture thing. Somebody should be given this information that they have an alcohol use disorder or an addiction by a professional. It's not something you can look at another person and say like, hey, you have an alcohol addiction. It's really important for them to see a professional professional and get this information from somebody who can examine them privately and without judgment. But generally, what we call it an addiction or alcohol use disorder when that person is having negative health, legal, or social issues connected to their alcohol use and they're continuing to drink even though they're having those problems. Just wanted to hammer home these cutoffs because I know I always forget these cutoffs. But looking at the left side first, we recommend that men drink no more than 4 drinks a day, no more than 14 drinks a week, and women limit their alcohol to 3 drinks a day or 7 drinks a week. I'm not telling you, hey, make sure to drink your 3 drinks a day. You can drink 0 drinks. That's good too. But just these are the cutoffs recommended to keep yourself under these numbers. What is a drink? I could drink a tall glass of vodka. Is that one drink? No, that's many standard drinks. So when we talk about these cutoffs, we're talking about standard drinks. So here we go. If it's a 5% alcohol beer, not all beers are 5% alcohol, but if it is 5% alcohol, a regular 12-ounce can is 1 serving. So I'm a woman, I'm going to a barbecue, I could have 3 cans of beer, and that's not considered risky. If I have 4 cans of beer, that's getting into risky territory. Malt liquor, 8 ounces, so you can remember that's like a cup. That's considered a serving of malt liquor. Wine is actually a smaller serving. So since wine has more alcohol in it, it's 12% alcohol usually, it's actually only 5 ounces that's considered a serving. But a wine glass, that's not that high up in the wine glass. So if you go to a restaurant and they pour you a glass of wine, so if you're trying to keep your alcohol use below 3 or 4 drinks, depending on whether you're a man or a woman, counting 1 glass of wine is not 1 drink. And then finally, with liquor, it's a shot. So a shot of liquor is 1 drink, and that's 1.5 ounces. Or what a shot glass looks like. That would be 1 drink. But often if you go to a bar, they're going to give you a cocktail that has 2 shots in it. So again, 1 cocktail is not necessarily 1 drink when you're counting your alcohol use. So this is very sciencey, but another thing to point out, this is information from 2022 for all of the United States. So of all of the people in the United States who drank alcohol in 2022, a little bit less than half of them were binging. So binging is very common. And I think a lot of people just don't have the information. They don't realize, like, I'm a woman, I had 2 cocktails, that was considered a binge. Not as many people have an issue with heavy alcohol use. So it's not as common in the US for a woman to be drinking more than 7 drinks every single week. But still, 60 million people in the United States have that issue. Finally, let's go to the category that has the most effects on health. So that is alcohol addiction. We also call that alcohol use disorder. As a professional myself, these are the categories that I use when I am deciding if somebody has a diagnosis of an alcohol use disorder. In that case, I want to refer them for treatment. We'll talk about what those treatments can look like. To qualify as having an alcohol use disorder, you only need to have 2 of these. So it's a pattern of drinking alcohol that leads to problems or distress with at least 2 of these things. This can be drinking more than you meant to, trying to drink less but having a hard time drinking less, spending a lot of time thinking about alcohol, getting alcohol, drinking alcohol, having hangovers, just like alcohol really taking over your life in that way, having cravings for alcohol, drinking alcohol even though it's causing problems at work or at school or at home, having problems in your relationship because of alcohol, deciding the things that you used to do, your hobbies, you're going to do less of them because you're drinking alcohol instead, doing things that are dangerous like driving while under the influence of alcohol or having sex in ways that you didn't mean to because you were intoxicated with alcohol, having harms on your health, but drinking alcohol anyway. So having high blood pressure, knowing that your blood pressure could be connected to your alcohol use, but continuing to drink anyway. Also tolerance, which means that you used to be able to have 1 drink and you would feel a buzz. Now it takes 2, 3, 4 drinks for you to feel anything. That's tolerance. And then finally withdrawal, which is if you don't drink alcohol and you start to get the shake or even start to have seizures, something really dangerous like that. So even just 2 of these problems is considered an alcohol addiction or an alcohol use disorder, especially if it's happening over the course of a year. So it's not just like it happened once, but it's happening on an ongoing basis. What can we do about this? I really like this information from the Centers for Disease Control. These are just some guidelines for how we can start to think about taking control of our drinking and saying alcohol is just not for you. You are going to abstain. You're not going to drink alcohol. But some people want to drink alcohol. So how can we do that as safe as possible? So first of all, do it with numbers in mind. Be very conscious of how you're drinking. Don't just start drinking willy-nilly. I actually lost count. I don't know how many drinks I had. Instead, it's a good idea to decide how many days a week do you want to drink alcohol. Are you going to drink just on the weekends? Is it okay for you to drink every day of the week? Do you want to skip maybe just Mondays? Give your body a little break? It's good to be conscious of that. It is a good idea to schedule some alcohol-free days. Also, like I mentioned before, you want to count your drinks. And these are standard drinks. So if you go to a restaurant and they give you a big glass of wine, or if you go to a bar and they give you a cocktail that's pretty strong, count that as 2 drinks and keep track. Try not to lose track of how much you're drinking. If you feel like in certain settings you're likely to drink more, think about that. Be conscious and maybe suggest other activities instead. So it's very common for people to go to a happy hour after work. Maybe suggest something that doesn't involve alcohol. Maybe people can go out for coffee, go to lunch, go to the park, play a sport, go to the movies. There are lots of activities that we can do that don't center around alcohol. And so that's good for our own health, but it's also more welcoming for our friends and loved ones who don't drink alcohol. If you feel like this is challenging or it could just be more fun and easier, do it with somebody else. Have a buddy who you're making changes together with. You're always more likely to be successful in making a change if you do it together with a buddy and you're accountable to each other. What else can we do? I also really like this picture from the CDC. There's a lot of the same ideas, but I like this idea of mindfulness, being aware of how we're drinking. So keep track of how much you drink. This is really good advice. Eat food and drink water and other non-alcoholic beverages when you're having alcohol. So going back to that barbecue example, you're having your hamburgers, your veggie burgers, you're keeping up with food while you're drinking during that barbecue, so that's good. But maybe have some water, have some lemonade, have some seltzer, have some non-alcoholic beer in between those alcoholic beverages. That's going to prevent you from getting too intoxicated, from ending up in a situation where something bad happens. Medication or other types of drugs, they can interact with alcohol in a very dangerous way. So if you take medications that make you sleepy, not drinking alcohol together with those medications is very important. If you take, or somebody you know, take anxiety medication like benzodiazepines, like Xanax, Klonopin, Valium, Ativan, those medications can be very dangerous together with alcohol. We also know that opioid use is very common in our community. So people who use opioids can be at higher risk of overdose if they drink alcohol too. So anything that makes you sleepy or out of it, that can be stronger if you're drinking alcohol too. Incorporate some activities that don't involve alcohol. What about if it's not an issue that you have, but it's somebody who you love? Here are some other guidelines for talking to a loved one who you think is drinking more than is recommended. They're having risky drinking, or maybe they're really having some problems with alcohol where you are concerned they might have an alcohol use disorder. So this is a really sensitive topic. You want to be as careful as possible in approaching somebody about their alcohol use. People have so much shame. Don't bring it up at a party or in the middle of a busy situation. You really want to set a special time to talk to somebody. Quiet place. You want to start from a place of concern, not anger or judgment. You want to check how ready they are to make a change, because we can never force somebody to want to make a change. They have to want to make a change. It's important to talk about specific behaviors that have come up, not just say like, oh, you're an alcoholic, you're a drunk, you're so weak, you have no willpower. That's just hurtful. That's not going to help somebody make a change. But bringing up specific things like, I was really worried when you didn't make it to work yesterday, things like that. Be less blaming. You want to listen to them, not just tell them what you think, be respectful, and have realistic expectations that people don't change overnight. So if you need to step away from that relationship, that might be the best thing for you. Give the person some space, but let them know that you'll be there for them. Or maybe you can't be there for them anymore. Maybe it's become too much of a burden on you. Let them know that there are professional resources available. Just quickly wanted to mention, since we talked about pregnancy before, that breastfeeding is also a time to be careful with alcohol use. It can be okay to drink alcohol while you're breastfeeding, but it is important to wait before you breastfeed, or even to pump and dump and pour out your breast milk before you give it to the baby, because the alcohol can affect the baby if you have several drinks of alcohol and then breastfeed right after. So for example, one drink, it's good to wait 2 or 3 hours before breastfeeding. And then just to close out with treatments, there are treatments for alcohol use disorder or for alcohol addiction. So if you know somebody, or if you yourself thinks that you might have an alcohol addiction, it's really important to talk to a doctor about medications that are available, because the medications are effective, and medications are the number one recommended treatment for alcohol use disorder. So there's a monthly injection called Vivitrol. That's very good. It also comes in pill form. That can be good for people who drink a lot on the weekends. They can take the pills on the weekends. There's another pill called Camprosate. And then there's some other pain medications for nerve pain that can also do double duty, helping people have less alcohol cravings while helping their pain. And finally, there are behavioral treatments like therapy. So if it's a family issue, there's family therapy, there's group therapy, there's therapy like one-on-one with a therapist, a psychotherapist. There are rehab programs where people just go away for a few days to detox from alcohol. They could go to an outpatient program where they visit every day or a few times a week, or some people will go into a rehab program for a long period of time, even for weeks or months. And then a final note about AA, Alcoholics Anonymous. This is a very widely available program. We don't have scientific proof that it actually helps people to stop drinking or to drink less, and it can be very judgmental. So Alcoholics Anonymous is very focused on drinking zero alcohol, completely stop it. So it might not be the right choice for somebody who wants to just drink less, but it is very available. And it's good for people to have a community. It's there for people, even if we don't have proof that it helps.
If you are someone that has had issues with drinking in the past, perhaps you're in that risk area or even the addiction area, is there any point at which you say, I can consider drinking safely and not be at risk anymore? Or is it more like you're always going to be at risk because of that?
So this is a very individual decision. Every person is different. There's no one size fits all. This is where it's really important to know yourself. And most people do know themselves. I hear this from my patients a lot, that like, if I have one drink, I'm going to be using cocaine in an hour. I'm going to be drinking all day. Some people know that they get completely out of control with one drink. Some people, they get their drinking under control and they can drink in moderation. This is a big part of harm reduction, that the person in front of me, whatever their goal is, whatever they know is right for them, that's the goal that we're going to work towards.
Just on some other options outside of AA, things to think about if you or a loved one are quitting or wanting to even just cut back on alcohol use. There's some other kind of options that focus on even just cutting back. So AA, like Dr. Collard said, can often be a little bit like judgmental. And even though we don't have enough data on peer support groups overall, including AA, I feel like there are a lot of people that do benefit. So if it feels like something that you just want to like check out or look at, all these groups have some sessions and there's specific ones for women. Even within AA, and Smart Recovery is another one that's like really good. They have specific queer groups as well as women groups, and then also Spanish, English, and other languages. So just checking some of these out if you or a loved one want to just like see what the conversations are about, because hearing other people's stories and experiences can be really helpful. Just wanted to show this.
Disclaimer too, that the Smart Recovery has nothing to do with us as Smart.
And the REACH program is also available. We're based at Mount Sinai. If you know anyone who has an alcohol addiction, alcohol use disorder, and they're looking for a primary care doctor, we try to be very non-judgmental and provide the full range of services from addiction to just regular primary care.